Annie Viliva. I'm a nurse practitioner student with Herzing University, and today I'll be performing a physical assessment of my daughter, 9-year-old daughter, Marie-Michelle. She has volunteered to be the patient. This will be the pretend examination table, the black chair, and as I ask her to walk to the examination table, I'll be observing her body position during movement, and as she's sitting, I'll be observing her body position at rest. Could you please walk across the room, turn around and go back? Very nice. And then could you please do tandem walking, means heel toe in a straight line all the way to the examination table, and please have a seat. I'm also, as part of the general survey, I'm observing for her posture, her grooming, her gait. Also, she's dressed appropriately, her facial affect is appropriate, her hair is nice and clean, her facial expressions and mood, manner of speaking, and state of awareness. She's alert and oriented. What is your name?
Marie-Michelle.
Good. The next thing, during throughout the assessment, I'll be also checking her skin as we assess each body part. Let's start with the head. I am feeling the hair for thickness. It's nice and thick, evenly distributed. Then I'll be checking her scalp. I'll be separating areas and checking the scalp for any deformities or depression or scaliness, lumps or lesions. Then I'm checking the face for symmetry and edema or masses. Next, I will be assessing the temporomandibular joint with my pointer finger, and I'm going to have her open your mouth. So as she opens her mouth and close, my fingers would fall into the joint spaces as the mouth opens. Next, let's examine the eyes, and in particular the visual acuity. We'll be using the Snellen chart. This is our Snellen chart. It checks the visual acuity. I am having the patient stand up, and I'm positioning the Snellen chart at 20 feet, and I'll be asking her to read the lowest possible line in the small print. Cover your eye, and then you're reading the lowest possible line. Then switch eyes, please. Very good. And then again, I'm going to ask you to read the lowest possible line. You can have this. The Snellen chart is expressed in two numbers. The first number is 20, meaning that the Snellen chart has been held 20 feet away from the patient. And the second number shows the distance at which the normal eye can read the line of the letters. I'm standing up in front of the patient, and I am checking the position and the alignment of the eye, the external eye structures, the eyelids, the cornea, the lens, the pupils. Next will be the pupillary reaction to light and accommodation. As I'm flashing our light, the light, the pupil's size should change and accommodate to the effort to focus on a near object. This is for you too. And also part of the examination includes checking the corneal reflexes, the conjugate movement, and convergence. With the ophthalmoscope, I'll be checking the ophthalmoscopic disc. I'm checking the ophthalmoscopic disc. Look at me, please. With the light, and I'm guiding the large veins, and I'm checking for clarity, color, symmetry, and papille edema. Next, you can have a seat, please. Next, we'll be examining the ears. The external part of the ear is called the auricle. I'm checking the ears, inspecting the ears for deformity, lesions, or lumps. With my instrument, I'm checking the ear canal. I'm pulling up and down. I'm checking the ear canal for any, here you can have it. I'm checking the ear canal for any bleeding or any foreign body or swelling. Also, the eardrum is also inspected for color and contour. Let's check the auditory acuity. Do you have any difficulties hearing?
No, I do not.
Okay. And if the patient answers yes, then we do the whisper test for deviation of the hearing. Let's check the air and bone conduction. This is done with two tests. The first, oh, where's my fork? The first test is the Weber test. So this is our conduction fork. It's placed on top of the head, and I'm asking the patient if she can hear. And normally she will say, yes, I hear in the middle or bilaterally on the side. If the patient says, I hear on one side, then we have a abnormality. The second test is the Rin or the Rhine test, where it's performed using the vibration tuning fork again. And it is placed behind the patient's ear. And when the patient stops hearing, then I place it next to the ear and ask, do you hear? And the patient should say, yes, I do hear. Here you can have it. Next is checking the nose and the sinuses. With my pointer, I'll gently press on the tip of the nose and the nostrils should enlarge. Then with my light, I am checking the septum, examining the hair, checking for any deviations. The septum should be intact, and the nasal mucus should be free from ulcers and bleeding. Let's examine the frontal and the maxillary sinuses. The frontal sinuses are palpated in the base of the eyebrows, and we would like to try to avoid pressing on the eyes. The maxillary sinuses are checked right here by the cheekbone, gently press. So these are the maxillary sinuses. Let's check the mouth, and after that will be the pharynx. I will be checking the lip, checking for moisture, for color. It's nice and pink, hydrated. I'm checking also the gums and the teeth and the upper and the lower. Next is the tongue. Stick out the tongue. It has nice pink papillae, free from any lesions. Stick out the tongue. Also check the cranial nerve 12. The floor of the mouth also looks nice and pink. Let's check the pharynx. Keep the tongue inside. Keep the tongue inside. Open your mouth and say ah. So this also checks the vagal or the cranial nerve 10. And in this test, the soft palate goes up. The soft palate rises up. Let's check the tonsils. Open your mouth. Stick your tongue out. So the tonsils are nice and big and pink, and they're free from oxidate. And the last portion of video number 1 out of 3 is the spinal range of motion. I'm going to have you stand up and do the flexion. Stand up, bend down as far back as you can, and checking for symmetry. Okay. Then we're going to check for the extension. Stand up, please. Bend as far back as you can. Very well. And then we have to test the Romberg test, where it is a test of positioning, where you have to close your eyes, keep your feet together, close your eyes for 30 seconds. And then the next, and you should be able to maintain upright position. Open your eyes, there you go. A normal patient should be able to stay in upright position with closed eyes. And then the last test is the pronation drift. So you have to stand up with your arms straight up, with the palms up, and close your eyes. And a normal person should be able to balance. Thank you very much, and this is video number 1 out of 3. Thank you.